Hemorrhoids are normal anatomical structures that we all have. These anatomical structures made mostly of special vascular tissue that sits on the top of the anal canal. The reason we all have hemorrhoids is because they play an important role in the mechanism of continence. This vascular tissue can inflate and deflate, contributing to the fine closure of the anal canal. Only when these normal anatomical structures become abnormal, like they swell up, increase in size, become congested, they start producing symptoms, and this is when we talk about hemorrhoidal disease, which should not be confused with hemorrhoids as such. Hemorrhoids become abnormal when they become swollen and inflated over their normal limits. The reason why they become abnormal could be different. Normally, generally speaking, everything that can cause a prolonged increased pressure inside the abdomen, leading to an obstructed outflow of the blood from the hemorrhoids, can in time lead to abnormal hemorrhoids. For example, things like chronic constipation, spending too long sitting on the toilet trying to defecate, can certainly contribute to the formation of hemorrhoids. But also other relatively common things like pregnancy can also lead to the same problem. Patients may be predisposed more than others to this condition, and in those cases also simple standing up for prolonged time or strenuous physical exercise may contribute to the development of abnormal pathological hemorrhoids. Hemorrhoids become symptomatic only when they become abnormal. By far the most common symptom of hemorrhoids would be rectal bleeding. The bleeding normally consists of bright red blood occurring after defecation. It is often not associated to pain, and often pain is not a common symptom of hemorrhoids. For more advanced stages of hemorrhoids, when they become bigger and more swollen, they start prolapsing as well, which means they start protruding through the anus, normally once again after defecation. For the initial stages, normally the prolapse reduces spontaneously. However, for more advanced stages, the hemorrhoidal prolapse may require manual reduction, so the patient himself or herself has to reduce the prolapse back inside. And for even more advanced stages, the prolapse may become very frequent, may occur spontaneously, not necessarily associated to defecation, and may become even very difficult to reduce, to a point that the hemorrhoids may be protruding most of the times. Discharge and discomfort can also be a consequence of hemorrhoids, especially when they are large and protruding regularly or more often. Severe pain only occurs when the hemorrhoids become thrombosed, which means when they become very big with a large blood clot in it. Most of the hemorrhoids, especially the early stage hemorrhoids, will respond to conservative measures and will not require surgical intervention. However, surgical intervention remains the most effective treatment for the more advanced stages. Treatments like injection sclerotherapy, rubber band ligation can also be considered, although these often are only offering temporary relief and will have to be repeated a few times to keep symptoms under control. For more advanced hemorrhoids, the most effective treatment remains surgery. Conventional surgery involves the excision of the hemorrhoids. This inevitably will leave the patients with 3 large open wounds, which may need several weeks to achieve a complete healing, inevitably this leading to prolonged postoperative recovery and pain. More modern surgical treatment of hemorrhoids involve also a technique called THD, which I pioneered in this country and I started offering to my patients back in 2002. This operation does not involve any excision or removal of any tissue, but is aimed to correct the hemorrhoids, preserving those anatomical structure and with them the role that they play in the mechanism of continence. The procedure consists of isolating one by one all the blood vessels feeding the hemorrhoids and applying few sutures to reduce the main blood flow to the hemorrhoids, which will then shrink and go back to a normal size and shape. After that, for the largest hemorrhoids, especially those with more significant prolapse, I have also introduced another stitch which aims to lift and fix the hemorrhoids to where they belong to, preventing further sliding of the hemorrhoids and therefore eliminating the prolapse as well. Because of the place where we position these sutures not being very sensitive to pain, normally the operation is associated to minimal postoperative pain with a quick recovery and very, very low morbidity.